Hello, and welcome to another part of Dr. Rhona and London Hygienist, aka Anna Middleton. Don't forget to subscribe and like to the channel because I love to give you guys everything that you want to know. Why are the gums so important and what can happen if you don't brush your gums? We're going to go through how often you should clean your teeth at home, what you should be doing, how often you should be getting your gums checked and cleaned, and what can happen if you don't look after your gums with or without veneers and bonding, and what can happen when they are not cleaned when you have the veneers and bonding in place. So without further ado, drum roll, Anna is going to talk a little bit about gum health, why the gums need to be looked after, how often we should clean them.
Okay, so your gums are extremely important regardless of whether you're having dental work or not. They should always be nice and pink and no bleeding. Bleeding is a sign that you have some gum disease. In the early stages it is reversible, but if that's left to progress, it can become irreversible damage, and then you get things like gum recession, you can even get like mobility, and in the worst case scenario, you can actually lose your teeth.
Just want to interject there though, because one common thing that people think is that when they bleed, they should stop brushing. They almost think that bleeding is something that's happening as if you had a wound or a cut, and they think if I leave it, it will clot itself and the bleeding will stop. No, it is not the same with the gums. If you ignore your gums, i.e. if you're just expecting the bleeding to stop on its own, it won't, because plaque is the thing that causes inflammation. Inflammation leads to bleeding gums, and if you don't disrupt that plaque or remove it, the bleeding will get worse. So gums do not clot in the same way skin does, and I think that's quite a good analogy. I came up with that.
Yeah, I like it. I like it. And I always say, if it's bleeding, keep cleaning. There will be a period, maybe for a few days or even up to a week or two, where when you're brushing or flossing, you may notice that bleeding, but as it goes on and you keep up the routine and the oral hygiene, then you'll notice it start to go away.
Absolutely. So we have gone on to why you need to clean your gums, but that brings me on to the next really important part. How often should you be brushing? Well, it is actually twice a day, every day for 2 minutes. And a lot of people think brushing once a day is enough, but it really isn't. And some people think brushing for like 30 seconds is enough. Time yourself. 2 minutes is a really long time. It's like watching a microwave, but it needs to be done, and it needs to be done for those whole 2 minutes.
And also, the common mistake is that we just brush the teeth. You need to brush the gums as well. So when you're brushing, place the toothbrush half on the tooth, half on the gum. If it's an electric toothbrush, let it just glide gently along the gum line. Don't scrub, don't force it. And if it's a manual, just gently do 1 or 2 teeth at a time.
And often people ask, what kind of electric toothbrush should we use? Is it oscillating or is it sonic? I think it's personal preference. There's lots of studies and science behind both. I personally prefer a Sonicare one, so does Anna. It's just because of the way that it feels. One key thing is that don't use a battery-powered one, because you'll never know when the battery starts to run out. When the battery starts to run out, the effectiveness goes down. So you want a charger-powered one. What would you say though for those that are saying, you know, I've seen electric toothbrushes that retail for £20 and then I retail them for like £200.
Yeah.
Where should I go?
So yeah, navigating your way through the sort of oral health aisle in the supermarkets can be a bit wild, but I always say choose one, if it's your first one, sort of in the middle, like a £50 max. Make sure it's rechargeable, make sure you change the brush heads. And also, you can always message one of us and ask us which one we think. But what happens is the more expensive the toothbrush becomes, generally what you're paying for is what I call bells and whistles. So fancy brush case, extra brush modes, different cleaning heads. But actually, if you just need your sort of like entry-level basic one, sort of around £50 is going to get you what you need.
Great. So, is brushing just enough? Say that you're really good at brushing. And by the way, guys, the whole manual toothbrush is not a thing. Anna and I will be going through the way that you should be brushing, but that can cause gum recession. It can cause something that we dentally call abrasion. So that's where you literally can scrub the gums away. So an electric toothbrush prevents you from doing that. But it's not enough. You need to clean between your teeth, and we always recommend interdental aids. What do we mean by interdental aids? That's things like PP brushes, floss and water flossers. Anna loves the Philips Sonic one. I love the water pick one, but you know, whichever one you choose, it does help clean below the gum line and is really great for people that find flossing difficult. That mechanical cleaning where you can get the brushes between the teeth is really, really important, because decay doesn't just form on the surfaces of the teeth, but also between the teeth. So when you have food, the bacteria that's naturally occurring in your mouth, they'll use the food, they'll produce sugars and acids, and that basically eats away at the teeth, and that can happen in between your teeth. So if you're not cleaning between your teeth, you are at risk of developing holes, also known as cavities.
Also risk developing gum disease in between as well, because that same bacteria likes to hide in all those little nooks and crannies, and again, the bacteria and the toxins irritate the gum, but it's not just the gum that gets irritated, it irritates the bone as well, so you can get bone loss. I always say as well, if you have the space, try and use the interdental brushes, and if you don't have the space, then opt for floss. And again, things like water picks, air flossers, they're really handy for
and
any.
Super floss.
Yeah, super floss is good, especially if you've got those like hard to reach areas. Yeah, bridges, braces, implants, all those sorts of things. It's really important. Brushing only cleans 60 to 65% of the tooth surface, so you need to get in between.
Exactly. So we've got that. Brush twice a day, every day for 2 minutes with an electric toothbrush. Put the toothbrush on the gum line and the teeth. If you keep bleeding, keep brushing, because it's really, really important that you're getting rid of those plaque areas, and also to use interdental aids as well. Mouthwash. So I always say it's a little bit like using deodorant without taking a shower. It's really important that you actually clean properly before considering using mouthwash. It can be used as an adjunct, but it does not replace brushing, because you need that mechanical pressure and movement on your teeth to physically remove the plaque and bacteria.
You can't throw a bucket of water over a car and expect it to be clean. You know, you need to get the sponges out and get not scrubbing the teeth, but you want to get cleaning the car. It's the same with the teeth as well. Gentle rubbing of the teeth and the gums. But the plaque is really, really sticky, and when it's like formed really thickly, mouthwash won't penetrate that and get rid of it at all. And it doesn't go below the gum line either.
You might find that you get lots of calculus build-up. Calculus is basically that hardened plaque. It's a bit like getting limescale on the bottom of a kettle, and it can't be removed by yourself at home. We know that there's loads of products going around as well on the internet that's suggesting you can disrupt that calculus at home. We do not recommend it. Those instruments can be very damaging to the gums and the teeth. So when you come in to see a dentist or hygienist, they will remove that calculus for you, and calculus is really important to be removed because it can cause gum recession. Anna has already mentioned how important it is to clean the teeth and the gums without having veneers, crowns, bonding. But what if you have all that work done? Really, really, really important that you're even more meticulous with your oral hygiene. We've introduced a foreign material into your body, although it is what we call biocompatible, i.e. it can integrate well into the mouth. It's really important that you're cleaning those areas, especially with bonding, because bonding picks up more plaque than the normal teeth because of the nature of resin. In fact, I'm going to show you quite a disturbing photograph. This was not treated by myself, it was by two colleagues, Dr. Alidad, who is a gum specialist, and Dr. Payman. I know them because they're just awesome dentists, and they posted this case on social media, and it was an incredible job. But this shows you what happens when you don't look after composite veneers, and if composite veneers are also done perhaps below the gum line and not done in a way that your body responds well to it. Gums are super inflamed, super puffy. They've actually overgrown over the teeth, and it needed gum surgery. So Dr. Alidad had actually removed the gums and stitched it all together, as you can see in the after photo, and Dr. Payman as well had redone some of the restorative work. So it can be quite bad, you know, if you don't look after it. And Anna is my most important person in the practice when it comes to maintaining that work. Veneers are made out of porcelain, and they're actually more biocompatible with the gums, so they don't pick up as much plaque as bonding. But again, cleaning between the teeth is so important. And what do you usually see with people that have had work? What's the problems that can occur?
The main one is that they're not brushing that gum line, and so that gum line starts to become inflamed, red, swollen, starts to bleed, and then they avoid it even more. Now, in actually doing that, if it's left for a long enough period of time, it can cause permanent recession. So then you have a gap between your bonding or your veneer and then where the gum has like settled itself down to. So often, again, the margins, while they're smooth, they're not smooth like your tooth surface used to be. So it's more susceptible to plaque getting trapped in and around them. So that's why it's so important not only to have, you know, the hygiene treatment before, during and after, because the oral hygiene routine is going to change along the way.
Yeah, absolutely. So it's really, really important. And sometimes I have seen cases where I fitted veneers and people stop looking after their gum line because they're afraid the veneers are going to fall off, and even though I've told them that they won't. And then they develop a lot of inflammation around the gums, and then once the inflammation resolves, the gum actually recedes. So you really don't want that from an aesthetic point of view, but also a health point of view. So it's really important that you're constantly brushing the gum line, cleaning in between your teeth, because things can happen. And you know, sometimes some restorations are done in the mouth and they invade what we call the biological width. So basically the biological width is a distance that we have to respect in dentistry, where we finish our margins for the veneers or for the bonding. And if there's invasion of the biological width and poor oral hygiene, you can get severe inflammation, gum disease develops, and in really bad cases you can actually get bone loss, which means that, you know, the teeth are going to suffer and there'll be risk of tooth loss. That's obviously in really severe cases, but it just shows you this is a preventable disease if the bonding and veneers are done well. And you know, with the help of us, we can make sure that you are maintaining things nice and healthy. So summary, because I love my summary so that everyone understands. You need to brush twice a day, every day, with an electric toothbrush. Brush the gum line, use interdental aids like TP brushes, floss, water flossers, and also don't be afraid of bleeding. Bleeding is a sign of gum disease, but if you're brushing it well, then make sure that you are brushing it well enough that the bleeding will eventually stop. Obviously see a hygienist to make sure that you're doing it properly. Go for your 6-month visits, 3 months visits, however long it takes to get you up to health, and you need to maintain that constantly. Have I missed anything out?
No, I think if you do notice that you have bleeding gums, give it everything a go in terms of your oral hygiene at home. And if, say, after 2-3 weeks you don't feel like it's getting any better, then consult a hygienist or a dentist who can actually, you know, diagnose and find out exactly what's going on and tailor some of that oral hygiene specifically to you.
And we will be going through how to actually do the cleaning, so stay tuned for that. See you guys soon.
Bye.